Okay, folks, we do have a quorum present, so I'm going to go ahead and start this meeting. All right, would the clerk please call the roll?
Esri.
Here.
Farney.
Here.
Furtado. Greer.
Here.
Hanauer Friedman.
Here.
Locke.
Here.
Lockshin.
Here.
Michaels. Owen. Pugh. Rodriguez. Rogers.
Present.
Sexton.
Here.
Smith.
Here.
Storr.
Present.
Yes.
Taylor. Thorsland.
Here.
Finish Theronot. Wilson.
Here.
Cowart. Carter.
Here.
We have a quorum. Would the clerk please read the notice of the meeting?
Notice is hereby given that a study session of the County Board, Champaign County, Illinois, will convene on February 27, 2024, 6 p.m. in the Shields Carter Meeting Room, Brookings Administrative Center, 1776 East Washington Street, Urbana, Illinois, in said county for the purpose of discussing the sale of the former Champaign County Nursing Home.
Thank you. Could I have a motion to approve the agenda? Okay, so moved. Locke, second. Carter. Have a motion and a second. All in favor? Oh, sorry, Mr. Farney.
I'd like to amend the agenda to move item number 7, presentations and discussion, and move that to right after this approval so that the public can hear all the information that we have available to us before discussion and public input.
That's a prudent idea. Thank you. Can I have a second on that? All right. Jenny Lockshin with a second. All in favor of the amendment, please signify by saying aye.
Aye.
Opposed, same sign. Motion carries. All in favor of approval of the amended agenda, signify by saying aye.
Aye.
Opposed, same sign. Again, motion carries. All right, we're going to move to the presentation and discussion piece. Thank you very much, Mr. Farney. I think that will be helpful. At this time, I'm going to do a brief narrative of county nursing home from sale until now with information that may be new to some people, may not be new to lots of board members. When the nursing home was sold in 2018, restrictions were built into the deed requiring it to be used as a skilled nursing facility until December 31st, 2027. This requirement applied to all owners of the facility. In 2023, University Rehab Real Estate LLC defaulted on the mortgage and allowed the Illinois Department of Public Health skilled nursing facility license for the nursing home to lapse. The nursing home was placed into receivership, and the receiver facilitated the process of selling the building on behalf of the bank. And they did have an extensive search. They had multiple outreaches to, I would say they indicated 50 or 60 plus entities that had expressed some interest. Because the skilled nursing facility license had lapsed, any entity wanting to open it as a skilled nursing home facility would need to acquire a new license from the Illinois Department of Public Health. Currently, IDPH does not consider Champaign County an area of need for skilled nursing facilities. The reasoning for that is IDPH works with different zones in the state of Illinois that have multiple counties. And they work within that zone in terms of the total number of beds. They don't have it broken down into smaller areas. I think it's very clear that Champaign County has a compelling need for additional beds, but that's not the process that IDPH is utilizing. And the current building, because of its age, is not in compliance with current requirements for a skilled care facility. I spoke personally with one of the licensing folks with IDPH, and he told me that he'd been there for 16 years. And in 16 years, he had never seen a nursing home whose license had lapsed reopen as a nursing home. Another quote that the receiver had received was the thought was that demolishing the building down to the foundation and rebuilding was the most likely way to have a nursing home facility on that site. The bank did receive bids for the facility, but none of them were for use as a nursing home. And initially they had sought extensively to find entities that would be interested in running it as a nursing home. That was the direction that the county board had placed when we spoke with them when they were looking for potential buyers. We're very clear about that, and they did follow through with that. All the offers are for substantially less than the outstanding mortgage due to the bank. And any of those entities would require the deed restriction to be lifted. Currently, the county does not know who the highest bidder is or what the planned use of the facility would be. Should the county board choose not to lift the deed restrictions and let it remain vacant until 2028, the county and other taxing bodies would not receive property tax revenue until the building could be sold. And the taxes have not been paid for at least the last 2 years. If the board does lift the deed restriction and allows for the sale of the property, the county could potentially recover some funds from the bank directly in lifting the restriction, and the county's portion of back taxes would become available to the county, as it would also for other taxing bodies that have not been receiving tax revenue from that property. And that's where we are at this point, folks. So at this point, I'll entertain board questions or comments. And once we complete that portion, then we'll move on and allow public participation, come forward and make comments to the board. And we'll see how we progress from there in terms of the direction the board wants in terms of a back and forth. So go ahead, Ms. Rogers.
Thank you. Do we know the range of how much less the bids are than the mortgage, or does that not even matter?
I do not have that information. We've not received that in our discussions through our outside counsel with the receiver.
Thank you.
Go ahead, Jen.
Just to clarify, this is not a mortgage that we hold.
No. Yes, go ahead, Ellie.
Do you have any sense of how much money we could get from the sale?
We are currently in negotiation through Polsinelli with the bank, and we have no numbers at this point. We've extended a amount that we think would come close to making us whole, at least with regard to our legal expenses, and negotiations are ongoing. So I don't have any number for you at this point. I'm sorry. Go ahead, Board Chair.
Thank you, Steve. 2 questions. Do we know what the potential business would be that would house that building? And will we hear from the attorneys tonight?
We will not hear from the attorneys tonight. We do not know at this point what the use would be, but I'm sure that before we would be lifting a covenant, we would want to have an idea what type of facility is going in there. I'm sure that would be the direction of the board. Go ahead, JJ.
I just want to share some information I just pulled up here. On the tax bills that are currently in delinquency, Champaign County's portion of those tax bills runs right around $20,000, $21,000. The biggest impact is on the Urbana School District for 1 year. That's just for 1 year. For 1 year, the Urbana School District's portion of that bill is $148,000. So we're talking significant funds, especially for our school district. The total bill on the facility runs each year between $270,000 and $306,000.
Further questions or comments? Go ahead, Eric.
Well, I rue the day that we had the mantra back in 2017 that we had to sell it to save it, because clearly that did not work. I'm glad you talked to IDPH, because I read this report and it said that we didn't have a shortage of beds, which I found shocking and astounding. We currently have 5 facilities in the county. We only have, well, one of them doesn't take Medicare patients anymore. That's 123 beds that we don't have Medicaid. There's 123, 60, 89, and 116 over at Clark Lindsay, but I think that number's old, but this is from the IDPH website. In January of this year, the 25th, our own public health department found us at least 300 beds short in Champaign County. In August of 23 last year, IDPH says we were short 721 beds because of the closure of all 3 of the Rothner properties and the loss of another one. So I understand the zone thing, that we get averaged into some aggregate here, but we're absolutely short beds. This situation is really unfortunate because I don't think anything we do symbolically, legally, or anything is going to turn that back into a nursing home across the way there at all. So thank you, JJ, for looking up those numbers. Those are not small numbers for the school district. They're not big numbers that are going to make us rich here at the county. But this is, as they say, we're on the horns of a dilemma here. This is, and all the other analogies that we say, this is a terrible decision that we have to make right now. And I'm sad that it's come to that. And it's not like we didn't know it was going to come to this. So that's all I have.
I think the board is really to be commended in that we've allocated substantial funds to have the Public Health Department do a study, a needs assessment, which could be a first step in trying to alleviate the problem that we have with the reduced number of beds. So far, we've made significant financial contributions to that. And I look forward to some of the other healthcare entities in Champaign-Urbana becoming involved financially and trying to figure out the best way to resolve this. Further questions, comments? Go ahead, Jenny.
Do you have offhand, I guess, what the other nursing home, or what the other counties, rather, in our zone are? Trying to remember that.
I do not at
information.
this point, no.
Okay.
I can seek out that information and provide it to you, but I do not.
Okay.
Go ahead, Ellie.
I would just say that it seems like we almost don't have a choice moving forward. And so I'm hopeful that maybe some of our public participation today will address ideas for moving forward and how to address the problem of the lack of beds, since it's such a significant issue. And I don't know how exactly the county can support that moving forward or be a part of it or not, but I would love to hear more from those who are here.
Any further questions or comments? Ms. Court, you've just arrived. At this point, I've given a brief narrative of where we are at in terms of the nursing home. I think you have all of the information available at this point, where right now we're simply considering the potential lifting of the sanction and trying to negotiate a settlement with the lender. If you've got any questions or comments, I'm happy to hear those. If not, I'm sure we'll have other opportunities later on in the meeting to bring those up. So I just want to make sure I extended that opportunity to you.
Okay, I don't have any comments, but my only thing I would say is that I would hope whoever gets the nursing home would turn it back into a nursing home, because it's a great need here in our county.
Thank you. Yes, there is indeed quite a need. Mr. Wilson, you had a comment?
I guess a comment and a thought. Surely there's a need, obviously, for nursing home care for people that need it. And, recently I had a dear friend of mine pass away. She was 95, but she was able to get care. And I'm thankful for that. But some people aren't able to get care. But I'm trying to understand, since I'm new to the board, and I don't have the history of the nursing home, is the only decision the county board makes is whether to suspend the deed restriction or not, and then whatever dollars show up, that's what the county has. Is that how I understand it?
We sold the property years ago, 4 years ago. So we no longer own the property. Literally, the only connection that we have at this point is the deed restriction that we put in place. That's the only connection binding this county board with the former Champaign County Nursing Home. That's correct.
And then one more question for my education. Then, what can the county board do with respect to satisfying the need for additional 300 beds? Is that in our jurisdiction, outside our jurisdiction?
Well, I think at this point, the study is being worked on to make an assessment. I know I've talked with other community members that have steps that they would be interested in moving forward with to try and attract a not-for-profit nursing home to this area. But at this point, that's outside of the purview of this board. And right now, the decision that we have is to whether or not to lift the deed restrictions, and having provided what's hopefully clear information to folks in the public, to hear their thoughts, and we can respond to those.
All right, thanks.
All right. Seeing no further comments or questions from the board, we'll move to public discussion and follow the format. I have the slips from several individuals, and once we complete with public discussion, we will move to communication, and there will be other discussion. First person up is Susan Schnurr.
Oh, Susan,
Oh,
before you start, sorry, the
Just
button.
push the button on there. That would
There, hey, important information already, thank you. Good evening, I'm Susan Schnurr, and I'm a member of the steering committee for the Advocates for Aging Care. And I want to thank you for inviting us to speak this evening. We really appreciate that the board is having this session and allowing the public to have input. I'm here with several other steering committee members and Champaign County residents. I will start with a general statement, and then Ursula Reuter Carlson and Peggy Patton will be sharing personal stories. We are eager to engage with you in discussion about the issue of skilled care nursing beds in Champaign County, and we welcome your questions and comments this evening. So for the newer board members, let me tell you a bit about our group. Advocates for Aging Care, or ACC, was formed to stand up for quality, affordable, and innovative nursing home care in Champaign County. We work with local government officials, nonprofit administrators, health officials, and concerned citizens to resolve issues surrounding the shortage of nursing home beds for the elderly and their families. Last June, our group attended a county board meeting to raise your awareness about the lack of nursing home care beds in Champaign County. During that meeting, we asked you for your help in obtaining more data about the issue, and also indicated we would oppose the sale of university rehabilitation unless it was sold as a nursing home. Since June, you'll be happy to hear our thinking has evolved. Let me address the sale of university rehabilitation first. We have listened closely as the county administrator and board members have outlined the reasons why we should lift the current restriction on the sale and allow it to be sold for purposes other than a nursing home. AAC has looked into the issue of using the current facility as a nursing home and has come to the realization that it would probably not be suitable, certainly not suitable, for a contemporary nonprofit nursing home. If the Champaign County Board decides to lift the restriction on the sale of the facility, allowing it to be sold for something other than a nursing home, AAC will support that decision and expects that the board will continue to partner with us to find a long-term solution to the current problem. The current problem is lack of skilled nursing care and rehabilitation beds for Champaign County residents. Research shows that the individuals who are in nursing homes need to have close contact with their loved ones and friends. It's critical to the health outcome of the resident that the family member be on site to be an active member of the healthcare team. If the only nursing home beds available are outside the county, then visits are reduced and transportation becomes a burden. With the closing of University Rehabilitation, we lost 233 beds. Clark Lindsay is reducing their number of skilled beds from 105 to 49. In total, we lack 300 skilled care nursing beds in Champaign County based on the Illinois Department of Public Health calculation. And this issue will continue to grow as baby boomers continue to age. I'm in that group. Statistics from the U.S. Census Bureau tells us by 2030, all baby boomers will be 65 or older. It is now when we need to start planning for the support systems and infrastructures that will be needed to meet our growing aging population in Champaign County. With your financial support and working with the Champaign-Urbana County Public Health District, we have launched 2 surveys, one for consumers and the other for health providers. We expect the results in April. We are also, with the support of the Champaign County Public Health Department, in the process of hiring a consultant for a market study to provide a projected calculation of bed need in the county. Again, we expect these results in April. The survey results will help us focus on needs in Champaign County. The market study will give us additional data about senior housing and nursing care beds in the county, and all this information will be available after you've made a decision about lifting the restriction on the sale of the nursing home. This is why tonight we want to not only show support for your decision, whatever it may be, about the deed restriction, but also give you a glimpse of where we might be headed and how you can help. Since it sounds unlikely that the facility will remain in the hands of a skilled nursing home operator, our expectation is, after talking with local health care officials, industry experts, and owner-operators of skilled care facilities, that we will need a new nonprofit contemporary facility in Champaign County. Now, let me stop here and say that neither the Advocates for Aging Care nor the county board should be involved in managing or owning a facility. Our role is quite different. We need to market Champaign County as a location that welcomes owner-operators of nursing homes who are interested in meeting the complex needs of the aging by partnering with local experts in design and technology. Well, that all sounds great, doesn't it? But where do we begin? The first step is to develop a business plan. The business plan looks at market feasibility, financing, and begins a conceptual design and estimate. The business plan is critical to attracting potential owner-operators to Champaign County. We will also require what is called a certificate of need from the Illinois Department of Public Health to justify additional beds. We will need financial support for both of these initiatives, and we hope to count on you, the Champaign County Board. We know that to be successful in meeting the needs of the elderly in our county, we need a strong coalition. The Champaign County Board is a critical partner as you bring not only resources, but networks and a deep understanding of the needs in Champaign County. But rest assured, you are not our only partners. We are also working with local industry leaders and community stakeholders, which include Carle Health, Christie Clinic, Health Alliance, OSF Healthcare, CU Public Health District, Champaign County Healthcare Consumers, the Community Foundation of East Central Illinois, the United Way of Champaign County, the University of Illinois GIES, the College of Applied Health Sciences, and the College of Engineering. Together we can find a solution to this issue. But let me leave you with one last thought. In the future, when you or I or our loved ones need a bed in skilled or rehabilitation care, wouldn't you be happy to know that you made it possible to find that care in Champaign County? Thank you.
Thank you. Before the next speaker, the chair would entertain a motion to suspend the rules limiting public comment to 5 minutes. JJ and then Jenny. That's a motion. A second. All in favor signify by saying aye. Aye. Opposed, same sign. Motion carries. Thank you. Next up is Ursula Ruther Carlson.
Hi, I'm here in behalf of the Moffat family, James Moffat and his family. And he writes, so he's speaking here. I have been a resident of Urbana since 1953. In the more recent past, we made sure that our home was set up so that we would successfully be, with some outside help, age in place. My wife had a bad fall in March of 2023 that required extensive surgery on her femur and warranted rehab services in a skilled nursing facility. We considered two things in our search: quality rating and bed availability. Our eyes were sadly opened to an unacceptable lack of availability for quality services in Champaign County. In fact, the list of Medicare-rated facilities in this area provided to us by the social worker at Cal had very limited local options. There was only one skilled nursing facility in town with a 5-star rating, Meadowbrook. We had successful experiences there a few times in the past for rehab after illness and injury. Unfortunately, by last year, inpatient rehab services were only offered to its own residents from independent and assisted living at Clark Lindsay. They were not accepting outsiders for inpatient rehab services. The other two skilled nursing facility options were rated with 1 star, much worse than average, and did not have bed availability. The second highest nursing skill facility rehab on the list, a 4-star, better than average, was located in Gibson City, over 40 miles away from our home. Additional, there was no bed available. It was a frustrating experience as we drove to surrounding counties and locations in search of a workable option, so that we could move my wife from the hospital to a skilled nursing facility in a timely manner to keep Medicare happy. We ended in Paxton, a 1-star rated much worse than average skilled nursing facility that did have a rehab bed space available. But the second day there, we knew it would be a very temporary situation for us. Sadly, the level of care matched its Medicare rating. We were able to move my wife to Heritage Manor, now Goldwater, in Gibson City on May 1st, 2023. In skilled nursing facility care and support she received, there was excellent. However, it was a 40-minute drive each way. My daughters, who live out of town, took turns staying with me and driving up there every day to spend lunchtime with their mother. At my age, I'm 101 today. It was too much for me to travel up and back to visit more than a couple times each week. If it had been a local facility, I certainly would have been able to visit my wife of almost 74 years more frequently. And the one experience also They had caregivers at home, but they could not drive him there because it was out of county, out of Champaign County. And then when my wife was no longer able to make progress with the rehab services, and it was determined that she would not be able to walk or sit up on her own, our needs changed from short-term Medicaid-paid solutions to a longer-term private payer situation. Again, it became clear that there were no good options for us as a family. We wanted my wife close by, and that was not an option. Unless we brought her home and switched to hospice care, private caregivers, and retrofitting our living room to a house, the equipment needed to be assisted. If there has been a quality skilled nursing facility option in town, we most certainly would have considered this, as it would have been a more affordable long-term solution to meet our needs. We brought my wife home right before Christmas of 2023. It was wonderful having her home, and she most certainly enjoyed being home. We were very pleased with the caring support and attention Traditions Hospice offered us. We found a workable situation with skilled caregivers from a fee-for-service agency to augment the loving care my adult children were able to provide us. They took turns being in town. My wife did very well for months before she sadly passed away at the age of 99 in late January of 2024. My purpose in sharing our experience is to ensure that other families can have excellent and affordable skilled nursing facility options to support their loved ones in close proximity to Champaign-Urbana. Please help us by maintaining a good county skilled nursing facility in incentivizing skilled nursing facility options by private companies within Champaign-Urbana. We owe it to our community's aging residents to allocate funds to ensure that there will be multiple skilled nursing facility options available to assist us as we age. From Jim office, thank you to you all.
Thank you. Next is Peggy Patton.
Good evening. As Susan mentioned, I'm here with Advocates for Aging Care to share a personal story. And I'm speaking tonight on behalf of myself, Peggy Patton, as well as my husband, Todd Kinney, who could not be here tonight. I'm here tonight to urge the County Board to address the critical shortage of nursing home beds in our area. Our recent experience looking for skilled nursing home care for our mother illustrated the appalling lack of care options for our elderly. We moved our mother from Ohio to Illinois in June 2022, hoping to have her in Champaign-Urbana to be close to us. In the spring of 2022, my husband and I spent weeks visiting numerous nursing home facilities in Champaign-Urbana and the outlying areas. Much to our dismay, we found no facility that offered satisfactory care, either because staffing was inadequate and or the physical facility was severely lacking. We needed skilled nursing home care and a facility that accepted Medicaid. We were especially disappointed by the response we received from University Rehab and CU. We tried on 3 different occasions to make an appointment to visit University Rehab Center of CU, leaving a message each time about the reason for our call. We never received a return call. Despite their frequent claim that they were forced to close their facility because of reduced demand for nursing home beds in our area, it appeared to us that University Rehab Center of CU was not at all interested in filling their beds. Fortunately, we found a wonderful facility in Gifford with compassionate and competent staff, as well as a comfortable and attractive facility. The Gifford facility only has 90 beds, so we were very fortunate that there was a vacancy when we needed one. Securing quality nursing home care for our mother was well worth the 30-minute drive to Gifford multiple times a week, but we were saddened and frankly appalled that such care was not available in Champaign-Urbana. We understand that you are considering lifting the deed restriction on the former Champaign County nursing home so that it could be sold to be used for something other than a nursing home. It appears that there are many practical reasons for lifting that restriction. We ask the board to negotiate some payment in exchange for lifting the restriction to help bring a new nursing home operator to town, one who is interested in providing quality skilled care services for our residents. Thank you for your service.
Thank you. Claudia Lenhoff.
Good evening. My name is Claudia Lenhoff, and I'm the Executive Director of Champaign County Healthcare Consumers. And I want to start just by saying that this outcome is sadly, utterly predictable, given who the county chose to sell the nursing home to, the Rothners. This is what we had warned about, what we were concerned about, and now the day has come. But I'm not here for recrimination. I know that you have a job to do. We are part of the AAC, and what I wanted to say was that I think the collaboration between AAC and the county board is some of the best example of community health planning that our community could do to try to find some sort of a solution, some sort of a possibility to create something new in this community when we are so lacking in nursing home beds, rehab beds, and so on. Champaign County Healthcare Consumers is part of the AAC, and the people who are in the leadership of AAC are really incredible. They are smart, they are thoughtful, they are knowledgeable, they are tenacious, and they are working for a solution for our community. I'm not going to sit here and tell you horror stories. You already know what's going on, but I can tell you that our organization, Champaign County Healthcare Consumers, gets the calls, the emails, the frantic worry from family members who are distraught at the prospect of not being able to have their loved ones cared for well here locally. And sometimes they're having to go as far away as Chicago. That's a real hardship. And it's such a hardship to be away from your loved one when they're vulnerable like that. We all understand that, and I know you all do understand that as well. I would just say from the Champaign County Healthcare Consumers perspective, like with the AAC, we do support lifting the deed restriction. We have to salvage something out of this situation. We have to salvage something. And those numbers about the property tax dollars that the Urbana School District is missing out on right now, and also the county, those are dollars that we can do something positive with. The last thing that I want to mention is that besides feeling like it's the right thing to do to partner with AAC to try to figure out a solution, also, the county nursing home was a long-time community health asset. The county invested so much into that asset. And so I am really hopeful that whatever can be salvaged from, lifting the deed restriction, selling the building and so on, that some of those resources could be put to use to working with the AAC to search for how to create a solution for our community. Thank y'all for your work on this and for really caring about this and for also, partnering with AAC. Thank you.
Thank you. Well, that concludes public participation. We'll move on to communication. It's a little different than a regular meeting, but do we have board communications with regard to comments that we've heard? Do you want to entertain any questions from individuals that have spoken to the board? What's the will of the board in terms of the direction that you would like to go at this point? Eric?
Well, before we deviate from normal communications, I do have one anecdote and/or note to say from the county board meeting Thursday. I got home about midnight. I got an email from a person who either attended or watched the county board meeting who bought a safe for their car to store their gun in. So that's one. We would like to get a lot more, and there'll be further discussion on maybe how to facilitate that. And now I'll return it back to the program you proposed.
I will say our part-time grant specialist is looking into the grant that was brought forward at that meeting, and hopefully we'll be able to apply for that. Go ahead, Samantha.
Thank you, Steve. I wanted to, I forgot your name, Champaign County Healthcare Consumers. For many years, I have sent so many people your way, the underserved, the uninsured, and I just want to thank you for the hard work that you also do for this community as well, because you play a big part in this. I would like to know, how often are you ladies meeting? I would like to join some of your meetings sometime and just kind of see what direction you're going in.
Somebody will need to come to the mic so people that are listening can hear.
We're meeting approximately twice a month, but we're also meeting with the community collaborative twice a month. So in total, it's 4 meetings a month.
In days and time, please.
It's usually on Thursdays at 2 p.m. But we can get you that information if you'd like.
Thank you.
Sure.
Further board comments? Go ahead, Jeff.
Thanks, Steve. Thank you, everyone, for showing up today. Susan, Ursula, Peggy, and Claudel, right? Thank you so much. Is that right?
Claudia.
Claudia.
Yes, sir. It's okay.
I'm working on it. Thank you, Claudia. Hey, so this question is for Susan. Susan, you talked about surveys and a market study. And can you help me understand more related to what the content of the surveys are and how broad or what's your reach on the survey?
Good question. So the surveys went out January 15th. There's 2 surveys. One is for consumers over 60 in Champaign County. And the idea is to try to understand what they need in terms of, or what they would like to see as they age in this county. So it's a broad survey. I'm happy to report that we were hoping to get 400 responses, and we're almost up to 800 responses, which gives us a pretty good feedback, which also says a lot of people are interested in this issue. So that's about all we know at this point, because we haven't analyzed the results. But that's going to be a very broad look at what are people thinking. Do they see the nursing home issue as important in this community, or do they have something else that interests them? We don't know yet. We'll find out. The second survey is for health providers, and these are really people who are placing patients in nursing care or other facilities. That is much more focused. We hope to get up to 50 responses, and that would be pretty good given our the number of health individuals that are working in this particular community. That should give us a real handle on how hard is it to find a place for somebody, right? That's where we should really know. The market study is really about secondary data. In other words, they're going to be looking at what should we have, how many beds should we have in the community, what's actually happening. They're going to be kind of analyzing all that to give us a bigger picture of what we think is happening. So we haven't hired the consultant yet for that market study, but we also expect that to be done soon, and then we'll get the results in April. So does that answer your questions?
Yes, and I've got another question, if you don't mind. I'm just inquisitive, I guess.
That's okay, I like questions.
Someone mentioned something about is it the CON?
Oh, yeah.
And So, I mean, the information I have, it seems like the Illinois Department of Health is saying, I'll put it in my own terminology, good luck with the CON because it isn't going to happen. Because of where we are located within their jurisdiction. And I think it's about, $2,000 to $3,000 for a CON. But,
More than that, but.
I mean, that's what I
Yeah,
read,
yeah.
but I could be absolutely out to lunch, which I usually am. So, but in this case, what's the prospects for success to go through the Illinois Department of Health with this certification of need or whatever, CON item?
So with the results from the surveys and also from the market study, we have some good data. But more importantly will be the collaboration we have in this community. People that are working with us that say, yes, this is an issue. Kathy Emanuel, who's part of our group, a leader in the group, has already done many CONs in her life. She knows how to approach this. She knows what data we need, and she's pretty confident that she's going to be able to make a good case for it. Yeah.
So then it's really just a matter of preparing one and submitting it, and then the Illinois Department of Public Health either accepts it or not, or are they forced to accept it?
No, I think, actually, my impression, am I wrong here, Kathy, do you know? My impression is that you actually have to go in front of them and defend it.
Before the
But
board
I
and then
don't know
defend it?
for
You go
sure.
before the board and,
It's a formal hearing that
formal hearing,
happens.
okay.
Yeah, yeah.
but that, I like to see things in a line. So you're saying after the market study, then you've done your needs assessment, and you looked at the surveys, then that helps you get an informed CON, and then you go through the process for the board appearance. Am I right on that? That's probably the process,
Yes, I mean,
okay.
yes, I am not the expert in this area,
Okay.
but I'll be happy to have Kathy write something up and give that information to you. She knows more about the process than I do.
Okay, thanks. I'm sorry, I didn't mean to put you
No,
on the
no, no,
spot.
that's fine, that's fine.
All right, thank you so much. I appreciate you very much.
Yeah.
Go ahead, Jenny.
I think this may be a question for you too as well, or possibly Claudia. I know in Ursula's letter that she read for the user, consumer, I guess, who needed eventually skilled care at home, is that something that's also tracked and covered here in Champaign County? Like what kind of at-home care options do we have? Do we have a lack in that area? I know it's not the same thing as skilled nursing beds, but I know there's a need for that as well, just for families who are caring for elderly family members at home, like me.
That's a good question. There's actually an organization that is putting together resources around that, what's available in Champaign County. But the survey also tries to capture some of that information. How easily can you access those services? Do you find them that they meet your needs? What else is needed? So the survey is pretty broad. It's pretty broad.
Did you want to add to that, Claudia?
Yeah, I was gonna say follow-up for that, though. That's not something I would have had access to a survey, because I'm not over 60, but we're caring for somebody who wouldn't be able to fill that out on their own. So, I mean, I'd love to know if that's something that's covered within the responses that you're gathering, that there are people who are caring for people who don't have the mental capacity to address what they need, so.
I will give you access to the survey. We also want people that are caretakers that are taking care of people that need that, so I'll make sure you have that. Claudia.
Sorry to horn in on you here. Your question about the options that people have, so much of it depends on their insurance, right? And one of the big problems with in-home care is that a lot of times people need what would be considered custodial care, just assistance with things that are not necessarily medical. Insurance companies tend to be better at covering home health care, so people who can come over and help with the actual health care. Where a lot of families struggle is more around the personal assistance, and a lot of times insurance doesn't pay for that or doesn't cover it well, and then a lot of times people don't have the resources to pay for it themselves. Another factor in that could actually be the structure of the home. Some people are not able to, even if they had access to the services and they were covered, they might not be able to have their loved one at home just based on accessibility, stairs, condition of the house, how old it is, things like that. So that's part of the struggle. So those are the things that can get in the way.
I will say that we're in a position where we're caring for my father-in-law at home because there was no Medicaid bed available for his needs at the time we were looking, and the private pay options were not something that he or we could afford. As he came here to Champaign County as an immigrant, didn't have years of retirement savings because they didn't do that where he came from. So it wasn't an option, and Medicare options for, like you said, at-home care too were also very limited. So I am very interested in this topic is what I'm saying.
I understand. Just on a personal note, some people here know I'm constantly traveling back and forth to Texas. My father is in home hospice. He's near end of life. I'm just home for about 3 days right now, so I can sleep at night, and then I'll be going back. And fortunately, his home, can accommodate a hospital bed and things like that. But it's really, really tough for families, and creating, having a community where people can have many different options is really, really important, because not everybody is similarly situated, for some of the reasons you discuss as well. So.
Any further questions? Go ahead.
Hi, I have a question for you all too. Just to give you a little background, I'm new to the board. My name is Carolyn, and I've worked in healthcare all my life, entire life. I started when I was 14 years old,
wow.
And I've taken care of the elderly all the way up until now. Even now, I work in an assisted living facility, and I feed them now. I was a CNA for 30+ years. So saying that, over the years, the quality of care I've seen diminish greatly. I've had the pleasure, sort of, working at the county facility, the new one. I'm not going to give you nightmares of things that I encountered in that building, but I asked myself why every day I went to work. And it was mainly the quality of care. So my question to you all is, in all of your studies and everything, are we dealing with quality of care? Because working in Champaign County was the worst that I've ever seen. And I've been everywhere, Texas, you name it, everywhere. Champaign County by far was the worst that I've ever seen.
So
I think we are.
Yeah, I think one of the issues that we have talked about, I'll just say this one thing and then I'll turn it over to you, but one of the issues that we have talked about, including when the nursing home was up for sale, was the difference in quality of care between for-profit and nonprofit and public nursing homes. And, I was personally ridiculed by some leaders in this community when we talked about that there is a documented difference. And it's not hard to understand. If a facility is for profit, it's for generating profit for the owners, the shareholders, whoever it may be. Whereas if it's nonprofit or public, the focus is on the mission. And the staffing levels are often better in nonprofit and public nursing homes. So anyway.
No, just to say that we are trying to capture some of that data too. Yes. Okay. So thank you for sharing that.
No problem.
Go ahead, Samantha.
In 2020, experienced nursing home care. My mom left the house one day to a doctor's appointment. She was perfectly fine, and she came back and she had her leg amputated. And so it was, everything kind of upside down. We didn't know how she would be able to come back to the home. We knew she needed rehabilitation after the surgery. And I was blown away from the care that we received at the county. My mom lost her leg due to diabetes. And I show up for dinner one night, and they had Cheetos and chocolate pudding. And I'm asking, the dietitian, I'm like, well, don't you see my mom is diabetic? Why is she eating this? She should not have anything with sugar. And then she tells me, oh, we found out that there's something with the cheese and the Cheetos that makes the sugar go back up. So I am, I know I haven't been on the board longer than 3 years, but I was very happy that it did close because like Ms. Greer said, the quality was not there. And I didn't want my mom or anybody else to have to suffer reaching out to them for care that was not A1 care. So I'm definitely interested. My mom is home now, but now we have a problem with finding that skilled professionals coming into the home to help her, and it is according to your insurance. My mom did work a job where she retired from, but there's so many restrictions, even with her insurance, of how many hours per day that she can get that service. And so within our family, I come from a family of 6, we all try to do our part to help fill in the gaps where the skilled worker isn't able to. So I think if you have an aging parent, this will be on all of our minds one day. And so I do appreciate you and this group being proactive, because if it's not a worry for you right now, eventually it would be. And I thank you all. I thank you all for all the work that you're putting into this, and anything that I can do to advocate or be involved, I would definitely like to. Thank you.
Okay, JJ, and then Beth.
Thank you. My question to you is, I'm excited to hear about this collaborative effort that we have to bring a community-based group together to work on this problem here in Champaign County. I'm just wondering, just out of my own curiosity, are there other communities that have approached it the same way? Do we have someone else that maybe has given us a roadmap to success? Or are we blazing the trail doing it this way?
We're unique. Is it on?
Okay.
Yeah, now it is. Okay. I think we are blazing a trail, but there are other communities that have approached it the way we have. And when we're working with the consultants who are doing the market study, they have a lot of experience all across the country in different communities that are approaching it in different ways. So we're looking into that. Yeah.
On my end, at Champaign County Healthcare Consumers, who we get approached about, or who we get approached by, are other communities where the Rothners are trying to go in and buy their county nursing homes. And people have seen the news and they want to know what happened. And so I routinely get contacted and have to tell our sad story. And I warn them the same way that we tried to warn, the previous iterations of the county board, that that model is very different. But I do believe we are trailblazers here, thanks to these amazing people.
Beth.
So as you can see, I think everybody has a story about either themselves or their loved ones needing this care and having a terrible time finding it regardless. From your responses, your survey for folks like that, I mean, everybody obviously has a story to tell and wants to tell it. You've got 800 responses, you expected 4. But it sounds like, if I'm reading between the lines correctly, that medical professionals are maybe not so forthcoming with stories. If you're struggling to get 50 responses to your survey?
You have to realize that it's a much smaller group that
Yeah.
we are canvassing. So we don't expect to get that many, because there are not that many that are in the business of placing people in the community.
I'm just curious, so when you say medical professions, are you looking for just doctors and nurses, or are you looking for people like Ms. Greer, who worked in facilities? Or are you
So
looking for people?
Discharged nurses, caseworkers, hospitalists, you know, all those people. But so we kind of narrowed the group that we're asking.
Towards what purpose?
Because then it was like, do we do speech therapists? I mean, so we really were trying to figure out who's placing people in the community and who understands that dynamic. So that's why we.
So you're focused more on placement than treatment once in a place?
Yeah.
Okay. That was what I did.
Don?
Yeah, I'd like to echo what a number of people have said. I really appreciate the testimonials, and I really am impressed by the collaboration. I do think it sounds unique from my understandings of what's going on elsewhere in the country. Those of you who don't know, I actually worked in a rehab facility before moving here, and it was a long, long time ago, but I come from 5 generations of doctors, and several of whom I've had to try to place in skilled nursing facilities. I would like to shift. I'm also new on the board, a little bit newer than Carolyn. And so I'm going to ask the newbie question. And I hope I'm going to direct it, I think, to the administrator. I think that's the most appropriate place. So I believe it was Ms. Patton who said, can the board put some of this money that we may get by negotiating to remove the restrictions on the deed, can we earmark it for the potential of attracting a nonprofit skilled nursing facility?
The board controls the purse for Champaign County. So that would be something that it would be a decision you would make during the next budget cycle, assuming that we are able to work out said agreement and assuming that we receive funds. But yes, that would be a board decision. Jenny?
I'm basically reiterating a comment I made earlier, but Chair Carter also mentioned needing to pull together family resources and cycle care for her mom. And that reminded me that my office just added to our demographic survey after many people commented that we had the option to choose care for a parent and care for a child, and we said we need both on the demographic survey. I think I would just highly recommend maybe adding that as a separate survey segment, people in the 30 to 60 or whatever age range who are approaching that time of needing to find care or care for parents or older family members. We're definitely thinking about this a lot too, as evidenced by a couple comments here, and then my office needing to actually acknowledge that as well. So thank you again for doing the survey. I would recommend, like, as working with the consultant, adding this group in. Thank you.
Go ahead, Jen.
Just as a point of information, how much does the county still owe on the nursing home?
The numbers that I'm recalling now are that we still have several funds that have about a $2 to $2.5 million deficit. We still have the expense of our outside counsel. We still have some funds that were owed us by the Rothners, which we will never recover. So we still are accruing some deficits at this point, but they're still substantial right now. Eric?
I thank Claudia, who's all along been a steady voice in this, and for ACC and all the work you're doing in the study and stuff. I started hearing about this when I first started running for county board in 2008. People were like, we got to sell that dog. It's a terrible thing. The county shouldn't run it. All that. And then the other side of the coin was it's a service. We don't expect the county highway department to turn a profit. Why do we always ask the nursing home to turn a profit? We had some referendum. There was not a lot of public support. They often failed to raise taxes. And then, of course, the vote to sell it from my side of the aisle was a failure because we voted to sell it. and weren't able to support it. So one of the most fantastic things I'm seeing is this public support from this group. One of the things I worried about early on as a member of the litigation committee when we were discussing this, and the Rothner is probably going to ditch us and run, was we felt like we would let the public down if we didn't really stick to our guns. We put the restriction in that covenant on for a reason. We really, really strongly wanted to maintain a nursing home in some fashion, even though we didn't own the property anymore. So to hear that, your group is in support of trying to realize some sort of solution to this. We've backed all the way down the alley now, and there's nothing we can really do but climb the wall or get hit by the car. So that's very helpful. What's really helpful, I think, is to really, and the news is here, so please put this on the news, not me, them, that the public's in support of resolving this and working towards a solution to get beds back in the county. And then Don mentioned earmarks. It's something I had written down notes earlier. If we can realize any kind of money for this, and if we decide as a board to waive, like paying back debt that the county is owed from the nursing home, that we could earmark funds towards working with groups like this to get another facility in here. I think that would be a fantastic thing to do during the next budget cycle, if that's a thing we're allowed to do, and if there's any money that we actually realize from this transaction. And so that leads me to the question, before the Rothners were out of the picture, we bantied about in litigation a number that we were maybe, what would be willing to tell them we would take if they were willing to put a pile of money on the table, we would lift the restriction. Is that something we can even do anymore at this point? Do we have any leverage at all with this restriction? Or are we really just being told, sit on it and look at it and lose all your tax money because a bank owns it, or lift the restriction and the bank is going to sell it and try to get their money back and get us our taxes?
I would say that we have some limited leverage, but not the same degree that we did with the Rothners, because at that point, they wanted to sell the home, and we were basically saying, if you are, then we want to take this percentage of it back if we give you permission to sell it. They don't own it anymore. I don't think we have that same leverage.
So our best option, it sounds like, is to just recover back taxes, end this situation, do what we can to help Urbana school system out, do the little bit that the county gets us and all the other people that are missing money for that. And then the work going forward, we're in the valley now, let's just get out and work forward with that.
We're going to try and work to see if we can get some compensation from the bank. It obviously would not be at the same level. And once the property is sold, then payment of back taxes would be part of the sales agreement. So we would recover those back taxes at that point. Go ahead. I've not heard from you, caucus chair, so please move forward.
Thank you, Steve. And I'm sorry for missing like the first 5-10 minutes of this, and you might have already covered this. I just wanted to verify where we are in the agenda. Are we still in communications? Are we going to have a presentation with a lot of facts? Because I would love to see that, because that looks next.
The presentation we did on the front end so that the audience would have that information before they came forward. I'd be happy to share that with you after the meeting. No problem. All right. Go ahead, Ellie.
Just a quick comment in terms of thinking about money. This is something also, obviously, we can think about when proposing a public safety sales tax and how that could be helpful with this situation as well. And then a question for our public. Are you able to share anything at this point about your communication with partners such as Carl, Christie, et cetera, in the university? It seems like there's a lot of potential there, both in terms of financing and quality of care, in terms of we have highly skilled researchers and scientists right here in our backyard. And when I spoke with Kathy earlier, the university already has a model in place in terms of laboratory schools. And, it seems like having a skilled nursing facility that has a research component could be extremely valuable. So just wondering if there's anything you could share about those conversations at this point.
So good questions. We are finding or have found out that nursing, that nursing homes that are successful are in a university community, and the university is invested in them. Sorry, I couldn't quite get that out. So yes, we are working very closely with the university in various aspects of the university to understand that. I can read a statement that we have from Carl and OSF, which is that both hospitals have committed to participating in an ongoing community collaborative. They've assigned staff that is attending all the meetings and are considering providing financial resources for a not-for-profit facility that could help meet their patients' needs. So we're meeting with them, yeah.
Go ahead, Don.
I just think that it'd be really important to remember that, according to peer-reviewed studies, Carl is one of the most profitable nonprofit hospitals in the nation. They're number 7 out of the 10 most profitable nonprofit hospitals in the nation. And I do think that we, as a community, need to remind Carl that they can contribute some to charitable care in this community.
All right, I'm not seeing any further communications from board members. We have no other business, so this meeting is, oh, I'm sorry, go ahead, Chris. That was close, Chris.
Well, it was, and I just wanted to add that I solicited comments from some folks in our District 10, and they regretted that we had come to this circumstance, but agreed that the lifting the deed restriction would be something that we should do. And I'll just say I thank all of the folks from the AAC and Champaign County Healthcare Consumers. All of you folks have been very helpful. I am glad that we have this group working, and I look forward to, sure the board looks forward to working with you. That's all. Thank you.
I would like to thank the members that came forward and provided public participation, and particularly Susan and Claudia for answering questions. So thank you very much for coming.
Welcome.
This meeting is adjourned.